Hi, it's Dr. Neil Schultz. This is Viewer Question Week at both BeautyRx and Derm TV, the third week of the month, and welcome to the May BeautyRx Live, where on live streaming video I'll answer your questions about BeautyRx skincare products and related skincare issues. BeautyRx skincare are the same patient-proven and award-winning products that have been giving my patients more beautiful, healthier, and younger-looking skin for over a decade. They address the ageless issues of color and texture issues, as well as, of course, lines and wrinkles. And they do it by stressing the daily use of 3 different skincare products: sunscreen, antioxidant, and of course, exfoliants. BeautyRx products are now available to everybody, not just to my patients. And BeautyRx Live allows me to answer questions about these for everybody. So if you have a question, go to beautyrxlive.com and use the chat box and submit a question. So let's go to the first question. Can I use a skin, this is from Teresa, and she asks, can I use a skin brightening complex if I am acne prone? How long would you expect it to take for results, and how often do you need to apply it, and where can I apply it? Teresa, very important. Whether it's a skin brightening product, sunscreen, moisturizer, any other skincare product, even if you're acne prone, there are products that are made specifically for people who are acne prone. And those products are labeled either water-based or oil-free or even non-comedogenic. So the answer, of course, is yes. And you should start to see some results in anywhere between 2 to 4 weeks. But a brightening complex can be used for 2 things. It can be used to remove brown pigmentation, which is what the BeautyRx brightening complex does, or it can be used just to make your skin more luminous and more lustrous and more even, smoother. And that's what the BeautyRx exfoliating products, which are glycolic based, do. Regardless of which it is that you're trying to achieve, 2 to 4 weeks is a good time to start to see results. Obviously, it's not going to be complete at that point, but that's how long it should be. How often do you need to apply it? That depends on which product you're using. So you need to just read the directions on the particular product. And in terms of where you can apply it, the traditional hydroquinone-based bleaching products needed to be applied just to the dark areas. Smarter bleaching products, which are peptide-based, again like BeautyRx Brightening Complex, they can be applied everywhere on your face. It doesn't matter where you put them because they're smart. They will only lighten the areas that are too dark. They will not lighten the normal colored areas. So of course, it's to your advantage to use these smart bleaches because you don't have to be as careful or as specific in where you apply them. We have a comment from Sophia. What is the pH of your 10% glycolic pads? Sophia, the pH is about between 3.8 and 4.0, and if you give me 1 second, I will check that for you. Sophia, it's exactly 4.0, so therefore the free acid in the 10% glycolic pads is between 4 and 5%. And of course, it's only the free acid which is acting to actually remove and exfoliate those dead cells. The advantage to having such a high pH in a product like the BeautyRx Advanced Exfoliating Therapy pads is that it's less irritating. So with 4% stable and balanced free acid, you get consistent results, but I do recommend that you use the pads on alternate nights, not every night. We have a comment from Paula. What laser is good for blue under eye circles? Blue under eye circles really requires a vascular laser. So the vascular lasers are things like V-beam and VersaPulse and Pulse Dye. The one that I find to be most effective is actually the Cool Touch laser, the Cool Glide laser, which is a 1064 nanometer YAG laser, and that is the one that I use for all of the periocular varicose veins, whether they're above, on the side, or below. We have a comment from Stacy. We have a follow-up question from Sophia. Is there any BHA in the 10% glycolic pads, and if so, how much? Sophia, BHA refers to beta-hydroxy. There's no salicylic acid in the advanced exfoliating therapy pads. I specifically did not use salicylic acid as an active ingredient, but I did put the salicylic acid, the BHA, into tetrafoliant. Tetrafoliant is actually a proprietary ingredient which is in all of my exfoliating products. So the tetrafoliant contains BHA, which is salicylic acid, in a very small amount, but it is not the leading exfoliant. Glycolic is a leading exfoliant, and the salicylic acid, which is the BHA, in a much smaller percentage, actually because it's lipid soluble, penetrates much deeper. A comment from Arthur. I heard that dairy products can cause acne because milk contains hormones that turn on oil glands. Is that true? Well, actually, Arthur, the hormones that are in milk are mostly estrogens. And estrogens, if anything, if they were in a high enough concentration, actually would prevent oil glands from turning on, not turn them on. As you know, and as I infer from your question that you know, oil production in oil glands is really only affected by male hormone, androgens, and by some derivatives of progesterone. So the hormones that are most apt to find in dairy products really are not going to have any effect on turning oil glands on, but they could actually protect, in theory, against turning oil glands on. But the bottom line is the hormone levels are at such low levels that it's really not going to have any clinical effect. So I just really wouldn't be concerned. Sophia says, where can I purchase the Skin Brightening Complex? I can't find it on BeautyRx.com. Sophia, for that, you would have to get in touch directly with my office or go to neilschultzmd.com, and you would be able to get the product there, or you can just call the office at 212-369-9600, and they would be able to send you that because it's not yet on the BeautyRx skincare site. Comment from Mike. Is Metazine 5 good for acne? Mike, my experience with products like Metazine 5 is that while they may be somewhat helpful for acne, they can also be a little bit irritating on occasion, and I generally don't respond to questions about specific brand names other than BeautyRx because it's not fair for me to speak for those manufacturers. So I think it would be most proper for me to refer that question, refer you for the answer to that question to the manufacturer. I am just looking through your questions. You've got some great questions here, and I don't want to skip any. We have a comment from Stacy. On and off, I get pimples. I know they're pimples because I can pop them and pus comes out. On my scalp, but mostly towards the front part and side parts of my head. Don't know why this happens. My husband says it's because I use cheap shampoo conditioners and she then mentions some particular brand names, and the change of season. What causes this and how can I prevent it? I do massage my scalp when washing. I don't use other hair products except an argan oil and heat protectant spray when I blow dry and flat iron my hair. Well, first of all, if you're getting any kind of pimples in your scalp, you certainly don't want to put any oils in your scalp, including argan oil. Because the pimples you're getting in your scalp, while technically they're called a folliculitis, which is an inflammation of the follicle, they really are partially related to acne in the sense that they're caused by a problem with the oil glands. And if you're caused by a problem with the oil glands, whether it's too much oil or blockage of the output ducts from the oil glands, the last thing you want to do is put anything on it that has oil. So my recommendation for pimples in your scalp, which really is this inflammation of the follicles, is to use a medicated shampoo. So medicated shampoos, by and large, contain either salicylic acid or tar. That is the ones that are most effective for this. So Neutrogena makes two different shampoos that might be helpful for you. One is called T-Sal with salicylic acid, and the other is called T-Gel, which has a little bit of tar in it, which is not offensive and it doesn't smell. But using these chemicals in your shampoo, because that's the best way really to get chemicals to your scalp, because it's really hard to apply lotions to your entire scalp because of your hair. But using a medicated shampoo would be the place to start, in addition to stop using any oil in your hair. BeautyRx has a soothing shampoo, which is salicylic based, and a therapeutic shampoo, which is tar based, which are also very effective for scalp folliculitis. I would give it probably 2 weeks to have results, and you would need to be shampooing with one of these shampoos at least every other day. Teresa asks, how long would it take to max out on results of skin brightening complex? Teresa, good question. If you're also using sunscreen at the same time, because the sun can darken your skin faster and more effectively than any bleaching products can lighten it. So if you're using an effective sunscreen, and if you're also exfoliating, which is important to get rid of brown pigment, because some of that brown pigment is just in extra layers of cells. Normal amount of pigment in normal cells, but too many layers because you've retained layers you haven't exfoliated. So if you're using an effective sunscreen every day, rain or shine, and if you're also exfoliating at the same time to get rid of the extra layers of cells that contain brown, and you're using the brightening complex to stop the new cells from making new pigment, you usually would max out probably somewhere between a month and 2 months. But to me, max out means achieve a therapeutic endpoint which makes you happy. At that point, though, you may still continue using the product to discourage your cells, which obviously make a little bit too much pigment, from continuing to make too much pigment. So at that point, instead of using it twice a day, you might go to once a day. You might then start to use it on alternate days over a successive period of weeks. But certainly within a month to 2 months, you should see a very good effect. Stacy says, what was the name of the pore treatment you mentioned in the last live chat? I have problems with unclogging my pores, even with using a cleanser with granular beads in them and a glycolic serum. Well, I agree with using a glycolic serum. I have a BeautyRx refining pore cream, which is a granular cleanser based on medium-sized polyethylene beads. And this is used only at the end of the shower in the large pored areas, and it's massaged very gently into the area for 20 or 30 seconds. The reason that you only use it at the end of the shower is because you only want to use it when the pores have been opened, so those grains can get in. Now, in the same video, in the same session, I may have mentioned my pore minimizing complex, and that is a product with several proprietary ingredients, drinking product that I've ever had, but it's not available for sale on the website. And again, you would have to call the office at 212-369-9600 and explain to them that you heard about this on BeautyRx Live to arrange to have that product shipped to you. Generally speaking, the pore minimizer complex is only used for patients, but for YouTube viewers, and of course, like the other BeautyRx products, we're in the process of developing a form of that pore complex that will be available to the public at large, so it'll be available on the website without having to go through the office. Comment from Adora. How much exfoliation is too much? I use 10% glycolic 3 times a week. In addition, I sometimes use a mild at-home microdermabrasion cream in the shower. I notice that my skin is smoother, but perhaps a little too smooth. That's not a problem we hear a lot, having skin that's too smooth. Some part of my skin looks even shiny. Adora, everybody's skin is different. Products such as the daily exfoliating cream or serum, depending on your oil and water skin type, that's an 8% product. As you may have heard me mention earlier in the program, the free acid, of course, is going to depend on the pH of those products. But assuming that it's an 8% product, which we start to use daily, then after a month, I then advance the procedure and the protocol to the 10% advanced exfoliating therapy pads on alternate days, continuing either the 8% cream or serum on the days in between. After a month of doing that, I then have my patients or use a percent product on those alternate days. So the people using the serum for oily, acne-prone, and combination skin would then advance to the 15% gel. And the people using the 8% cream for dry or normal skin would then advance to the 15% cream, while continuing to use the 10% pads on alternate nights. So one day the cream or gel, and one night the cream or gel and one night the pads. That, I believe, is maximum and adequate exfoliation. It should not make your skin look too shiny. If it looks too shiny, then you may need to back off a little bit on your exfoliants. But we usually get a good balance in exfoliation, which then should be causing a luster in your skin, a brightness. It makes your skin actually a little bit thicker, the live skin, not the dead, dulling skin. And as a result of that, the skin just looks less tired, younger, and more radiant. So Adora says that she was saying her skin looks shiny even when it's dry. Shiny like scar tissue. Is that too much exfoliation? As I mentioned at the end of the response, Adora, you may be over exfoliating at this point, and it might be a good idea, instead of using your 10% glycolic 3 times a week, try using it twice a week. Use sunscreen every morning. Use moisturizer on top of your sunscreen, unless you're using a moisturizing sunscreen, and use the moisturizer at night, and every night, including after the glycolic 10% on the nights when you're using that, and give that 2 weeks and see what happens to the texture of your skin. Cynthia asks, what laser is good for brown spots on the face, including under the eye area? Cynthia, actually for brown spots on the face, it doesn't matter where on the face they are. So all of the lasers that work for brown spots, doesn't matter whether it's on your cheek or your forehead or the under eye area. The only difference with the under eye area is that we need to use special shields to make sure that the laser light doesn't damage your eye, of course. But there are 3 lasers that are primarily used for brown. One is the YAG laser, the next is the ruby laser, and the third is the alexandrite laser. Now, these are the mechanisms of the lasers. A lot of different laser companies make different brand names of those lasers. So my YAG laser is a Medlight laser, and Candela makes an alexandrite laser. But what you really want to do, since the laser treatment is going to be administered by your physician, you really want to let him or her decide which laser to use, because you want them to use the laser that they use regularly and get the best results with. And the laser that they use regularly and get those best results with is the one they're most skillful with, and that's the one that's going to give you the best results. Mike asks, is Propecia more effective than Rogaine? Well, Mike, Propecia is an oral medication. It's called, the technical name is called finasteride, and it is much more effective than Rogaine. Rogaine is the brand name of a topical product of which the actual generic is minoxidil. And that's a topical product. And while 5% minoxidil, which is the strength that men use, can be effective and can help to regrow hair, when I see men for hair loss, I generally put them on both. And I tell them, 90% of your improvement is going to come from your Propecia, and I have taken that pill every day since it was released because I had a problem with thinning hair, and as many of you may know, the front of my hair is all transplanted. So I take great care of my hair, and I never miss a day of Propecia, but I also use my minoxidil or Rogaine as a brand name at the same time, and I would recommend both. Just give me one moment, folks. And by the way, this is BeautyRxLive.com. If you have questions, please go to BeautyRxLive.com. Use the chat box, and we'll be happy to take any of your questions concerning BeautyRx skincare questions, concerning any other related skincare issues. And of course, I'm Dr. Neil Schultz. I'll comment from Brandon. I know you say apply sunscreen first, but what about fade creams or gels? Are they treated like acne treatments? And how long should I wait until I apply sunscreen? Brandon, again, these questions show me the seriousness with which you take skincare, and that makes me feel real good. And that's why we do BeautyRx Live, for people who really have a deep concern and an understanding and want more beautiful, healthier, and younger looking skin. So the answer to your question is it really depends on whether the relative weight of the cream, the fade cream, or the gel. Gels are very light. If you're going to use it as a spot treatment, you can put it on first, just the way you can put spot acne treatments like salicylic acid or topical antibiotics, just on blemishes first, and then put your sunscreen on. But if you're using a product like BeautyRx Brightening Complex, which you apply all over your whole face, you still put your sunscreen on first, because we don't want to do anything to interfere with the ability of the sunscreen to set on your face in the same way that it set on the face of the people who were tested when the FDA approved the sunscreen and granted the SPF rating. There was nothing else on their skin. So if you want to get the true value and the true protection out of your sunscreen, it really has to be the first thing on your face in general. And as I mentioned earlier, when you have brown spots and you want to fade them, the sunscreen is more important than the fading product, because the sun can make more brown faster than the fade products can fade it. So if we're not getting the maximum protection from additional subsequent brown formation, melanin formation, by putting on an effective sunscreen first, then your fade stuff isn't going to work. So if you're just doing spot treatments, it's okay on small areas to put your fade product on first, as long as it's very light and thin. But in general, I recommend sunscreen first, additional products second, and if you feel that it's in conflict with your sunscreen, then use it at the end. Then use your fading product at the end of the day, after the sun has gone down, and then reapply it at night before you go to bed. So there's no conflict with sunscreen. We have a comment from a guest. How effective are homemade masks and scrubs? Well, that depends on how well you can make your homemade mask and scrub. I discourage people from making homemade scrubs because most of them are made from ground materials like nutshells. There's no uniformity of the size of the particle or the sharpness, and that's what causes irritation and problems. In terms of masks, it depends what you want to do with your mask. Homemade masks, whether they're clay masks, whether they are mint masks, whether they're used to absorb oils, most of these will be of some effect. They probably won't be as effective as store-bought products. So what you really have to decide is the money you're saving by making your own mask going to be worth some loss in efficacy of that mask compared to the money you would spend if you bought a store-bought product? I understand everybody wants natural. Everybody wants to be empowered to help and do things to fix their own skin. We don't want to rely on commercial products, store-bought products, but there's a reason that those products exist. And the reason they exist is because they work. So you are taking a chance on minimizing efficacy when you're making your own products because you just don't have the skill or the experience for quality control. By and large, I discourage people from doing homemade products because I want the products to work. I don't want them to get frustrated. So bottom line, they may work, they may not work. I would buy a commercial store-bought product. Well, we're talking about homemade products. So Sheila says, is there any homemade remedies that are good for acne, like Vicine or like toothpaste? And actually, toothpaste can be fairly drying and has astringent properties. Anything that's astringent, of course, is going to help acne. So I know an awful lot of people who put a dab of toothpaste on pimples at nighttime. You don't want to do it during the day or else you're going to walk around with white spots on your face. But toothpaste is okay. Witch hazel is a pretty good product to use. While it's not homemade, it's considered natural. Witch hazel is a good product to use as a toner and for removing oils. But by and large, most of the homemade products for acne, again, are not going to work as well. Salicylic acid, benzoyl peroxide, antibiotics, sulfur, resorcinol. These are the age-old standards. Some of them are 50 years old, but the reason they're around is because they still work. These are the age-old standards for treating acne. Sarah asked if there's any solution for dry, damaged, kind of frizzy hair just in front parts. I have fine hair. Well, Sarah, that's going to come down to using a detangler, a conditioner, a cream rinse, something that will coat the hair with very, very light oils to do two things. To make the surface of the hair shaft smoother and help repair frayed cuticle, and also to change the electrical charge, because it's the electrical charge, static electricity, that causes the hair to be so frizzy. So you're going to have to use a store-bought product, and there are many, many commercial products available. I can't tell you specific brands, but I will tell you that they are called detanglers or conditioners, and you really shouldn't have any problem. Just make sure that if you have oily or acne-prone skin, that you use it very lightly, because in the course of the day, the heat that's exuded and that you lose from the top of your scalp can melt and liquefy some of the oils that you've put on the shaft, and they float down the shaft to the scalp, and then some of them come down on your forehead. And then you start to get little clogs right along the hairline. We call it hairline acne. And it's usually caused by hair products that are just too heavy with too much oil in them if you have acne, oily prone, or combination skin, so you have to be careful about that. Roanne says, is it true that they're working on a prescription pill for gray hair? Well, that question probably comes from the fact that they recently have found the gene that causes hair to turn gray. Well, if they found the gene that causes it to turn gray, then they finally have insight as to what they need to do to prevent it from turning gray. So while this is being done in the laboratory, it doesn't have much relevance for my gray hair or for yours if you have it. And it's going to be a number of years until something like that translates from laboratory research to actually being clinically helpful for us. So I'm glad that you're keeping up on this news. And I was excited to hear that they found the gene. But again, we're talking 5 to 10 years minimum before something like that can be translated into a product that's marketable for public use. Roanne also asks, what's helpful for crow's feet? Well, there's a whole spectrum of products that are available for these crow's feet, starting with moisturizers to just help increase a little bit of swelling and add a little bit of volume to help, to, on a more permanent basis, all exfoliants, particularly glycolic-based exfoliants like BeautyRx skincare products, will cause additional filling in of those fine lines by creating collagen, by creating other materials under the skin, and by thickening the live skin as it removes the dead skin. That helps fine lines and wrinkles. Then, of course, there are products that are injected, like botulinum toxin, like Botox and Dysport. That will stop you from squeezing the muscles that makes those fine lines worse. And coming next year, in 2013, is topical Botox for the first time, a cream that will be applied by a physician in his office that will help relax the muscles that cause those fine lines and wrinkles without any needles. It'll still be a physician-applied product. It will still be done in the office at 3 to 4 month intervals, but that is the spectrum of what's available for crow's feet. Generally speaking, if you already have deeply etched crow's feet, then laser procedures will help generate even more collagen than topical products, whether they're glycolic exfoliants or even peptides that stimulate collagen production. But we're talking about deeper, more deeply etched crow's feet. Comment from a guest. I can't resist this one. Hi, Dr. Schultz. Just want to thank you so much for always giving some time to answer our questions. Very sweet. I appreciate your acknowledging that, and it means a great deal to me. Thank you. A guest says, I have a burn mark on my arm, about an inch line. Can I use a whitening cream to remove it? Well, a burn mark when it starts out, of course, is red. And then that red mark becomes brown, because when the skin gets injured, it makes more melanin and turns brown, just like the tan after a sunburn. So when you say a whitening cream, if we're talking about a bleach that helps to reverse or stop pigment formation, the answer is, of course, yes. That brings us back to the BeautyRx Brightening Complex, which is exactly what I give my patients when they come in with brown burns, especially on their arms or legs from having touched a hot pan or having touched the stove with either their arm or legs. They get a burn, which then becomes brown. If you're talking about the redness, which is before it turns brown, then for the redness you'd be using an over-the-counter 1% hydrocortisone cream or ointment a few times a day, but that's the best way to deal with either the red or the brown marks from burns. Comment from Brandon. I'm trying to minimize pores. Don't blame you, Brandon. I currently have a gentle exfoliating scrub. Would that be considered a granular cleanser? Yes, it would. That you use for 15 seconds after a shower. Well, actually, Brandon, yes, and you would use it at the end of the shower while the shower environment is still kind of steamy, so we make sure we keep those pores open so the granules can actually get into the pores. I also have 5% glycolic acid foam cleanser and 10% glycolic acid toner. Well, in terms of 5% glycolic acid foam cleanser, the problem is a cleanser doesn't have enough contact time on your skin. That's why there are no glycolic cleansers in the BeautyRx skincare line, because they can't work. You have a cleanser on your skin for 20 seconds, 30 seconds, maybe a minute. That amount of contact time with glycolic is not going to be effective. So I don't think the glycolic cleansers are particularly helpful. He then goes on to say, as a 10% glycolic acid toner, would the 5% cleanser be considered the chemical exfoliant? No, it would not. Which comes next, or the granular cleanser? Well, of course, the granular cleanser is used in the shower, and the toner is used after the shower, and so there really shouldn't be any confusion in what order to apply those. He says he also has a 15% glycolic lotion, but not recommended for the face. That's because 15% would be too strong to start as a facial product, but you should be able to build up to a 15% product, as I have my patients and other BeautyRx users do, by going from 8% to 10% to 15%. And he then says, could he dilute it with a moisturizer and apply that to his skin as the chemical exfoliant? When you start diluting your products with moisturizers or any other products, you really don't have enough control. You don't know that you're going to get complete miscibility. I don't recommend that. I don't think you'll get consistency in results, so I wouldn't recommend that. Comment from Paul. What's good for oily skin? I use all BeautyRx products and got a great result, but I'm still a little oily. Paul, I'm delighted that you're using BeautyRx products, and even more delighted that you're getting good results. If you're still too oily, then make sure that you're using the purifying toner after the balancing cleanser to maximize removal of as much oil as possible before you apply your other BeautyRx skincare products. Then, if that still isn't sufficient, you may need to use the balancing cleanser and purifying toner once or twice during the day to make sure that you're getting adequate oil removal, because the bottom line is no skincare products are going to stop you from making the amount of oil that you're making. They can help you remove it more effectively and that way reduce oil breakthrough. But again, the only thing that's going to stop you from making oil glands, and it's just unlikely that we're going to go to those lengths. So thanks for using the products. And if in fact by using the cleanser and toner more frequently you're not getting there, let me know, either through BeautyRx or through DermTV.com or by calling the office, and I'll be happy to work with you. Okay, so let's see what we have. Comment from Teresa. Thanks again. How is Cooper? What type of dog and how old is he? Teresa, Cooper's almost 7 years old. And Cooper's a golden retriever. And actually, Cooper is a female, even though Cooper is a male name. And Cooper is sleeping right over there at the foot of the desk here. Cooper is a sheer joy, and thank you for remembering Cooper. Comment from Brandon. Should you use a glycolic acid peel of 40% on your face if you have large pores? If achievable, what cautions must you take? Brandon, I love your enthusiasm and I want you to get great results, but I would discourage any person at home from using a 40% glycolic product. Number one, it depends on the pH of the product. If the pH of that product is 1.5 or 2, you're going to have 40% free acid, and I will bet you it will burn you, no matter how lightly you use it. If it's a higher pH, if it's a pH of 3.5 or 4, and you have perhaps 24, 26% free acid, you would still have to know what signs to look for as you're using it. What does pinking mean? What does the initial tingling mean? And what's the difference between tingling versus burning after you start to apply it? And at what point do you need to neutralize it? A 40% product should be used either in a spa by skilled professionals or in a physician's office. I don't recommend ever using a 40% product at home, and I would use nothing more than 20% at home in terms of glycolic exfoliants. So I think that's going to wrap it up for today for BeautyRx Live. Thank you for your questions. Thank you for your interest, and appreciate your supporting both more information about skincare and your quest for knowledge. You can ask questions, any questions that I didn't get to. You can submit to me through DermTV.com, and I'll try to get to them that way because we had so many great questions. I know I didn't get to answer them all. Please keep sending in your questions. So many DermTV episodes are based on the questions that I get from you viewers. And please join us next month, third Wednesday of the month, and we'll resume BeautyRx Live. Thank you, everybody, and have a great Memorial Day weekend with lots of sunscreen.